So HER2CLIMB was a randomized, blinded, placebo-controlled trial that tested the value of tucatinib added to a backbone of trastuzumab and capecitabine in patients with HER2-positive pretreated metastatic breast cancer. So all patients enrolled in the study were required to have had prior trastuzumab, pertuzumab, and T-DM1, so this was a heavily pretreated population. And importantly, half of the enrolled patients had brain metastases at baseline, which is very unique in terms of the study population enrolled in HER2CLIMB. The primary results have already been published in the New England Journal and demonstrated improvements in both progression-free survival and overall survival for the overall study population. But at ASCO this year, we presented results of a subset analysis of the 291 patients with brain metastases enrolled in the trial. And what we looked at was CNS progression-free survival, that is time from randomization until CNS progression or death. And we found that the addition of tucatinib reduced the hazards of CNS progression-free survival by about 2/3, and that translated into about a 5-month absolute improvement in median time to CNS progression or death. And we also found significant improvement in terms of overall survival with a hazard ratio of 0.58, and that also translated into about 6-month absolute improvement in overall survival medians for this patient population with brain metastases at baseline. And finally, to solidify the intracranial activity of tucatinib, the response rate intracranially was looked at among the patients with measurable intracranial disease at baseline who had progressive METs going on to the trial, and the intracranial response rate was about 50%. So all in all, I think really confirming the intracranial efficacy of tucatinib and the ability to prolong survival, not only in the overall population, but specifically in patients with brain metastases.